Hello, everybody. My name is Dave Kelber, and I am very pleased to have with me on the program today Dr. Helene Nguyen, who is from Feet and Beyond. They're located on Mountain Avenue in Hackettstown. But before we get any further, let me welcome you to the program, Dr. Nguyen.
All right. Thank you so much, David. I'm glad to be here.
Well, we are going to, first of all, talk about Feet and Beyond. You are located here in Hackettstown. Give us your address and our listening audience your address and the vital statistics, as I call them, your website, etc. Okay, go ahead.
Yes, we're here in Hackettstown, in the heart of Hackettstown, Mountain Avenue, 188 Mountain Avenue. Our phone number is 908-576-0880. And also, you can visit us on our website at www.feetandbeyond.com, which is FEETNBEYOND.com. Also, follow us on Facebook and Instagram. We are there.
Okay, very good. Well, today I thought we would talk about really minimally invasive problems that a person would have, more simple conditions that are maybe more common that you see. So maybe detail some of those kinds of things that a patient might be experiencing, viewing or listening. And let's talk about those, shall we?
Yeah, so this technique is called minimally invasive surgery that has been used widely for many years, and we start adapting this technique and implement to our office because of the availability of be able to operate on the patients on our office setting. And it become more common now because the techniques can correct from the mild deformity of foot and ankle to very severe foot and ankle. So to answer your questions, most of the mild conditions that is typically bother the patient come to see me is hammer toe. Hammer toe is when the toe is bending and sometimes it's rubbing against the shoes as it bothersome. It doesn't look too like crazy. But when the patient start walking, it creates blister because of the pressure on the area. So that is a mild case that I see. Or corn, like little callousy on the skin. It causes a pressure when the patient's activities. That is also one of the mild condition that we treat at our office. And that can be done, a very simple procedure. Done through minimally invasive. There's no hardware. There's one stitch incision and sometimes no stitch incision.
Wow.
Yeah, the patient can literally walk out the same day. There's almost like no downtime for the patient with like just a callus or hammer toe correction.
Now, some hammer toes I know are so severe that patients are literally walking on that toe, and that can be extremely painful. Am I right?
Yes. So if the hammer toes didn't get treated or addressed like in the early phase, then it can get to moderate to severe conditions. Like sometimes can affect the other toes, and it's either cross over or cross under the big toe. When we see the second toe get advanced at the advanced phase of it. The good news is minimal invasive surgery can also correct that too. So it's not just like for the mild case, but can also correct at the more severe and complicated.
The thing that I think ought to caution patients, potential patients, to consider is the fact that the more you wait, the longer you wait with that pain, the worse the condition is going to be. And who knows, it could develop into a problem that would require more than just minimally invasive surgery.
That's correct. You get right on that. We usually, when we see patient at the office, we address the patient from the beginning to the end. What that means is we start the patient with a conservative option. And if I see a patient that the conservative option is not kind of, I would call it undertreat the patient, I would intervene with the surgical option. And through this minimal invasive techniques that we can do that. There are cases that we have patient coming in, severe hammer toes or bunion, or that's just one of those typical, foot deformity. And patient has been trying all different things over the counter. They have padding, they have toe strapping, they have one of those gadgets they bought from Amazon, try to like correct your hammer toes.
Right.
And they turn out to become more of the problematic because it's affecting the soft tissues of the joint. So when you're correcting it, you kind of like have to recorrect the whole entire realignment the whole entire joint and the soft tissue structure of it. And it could be a little bit more long throughout longer recovery time if we wait.
Okay. Now, maybe we could just for by way of reiteration, so to speak, give a laundry list of those things that you would consider relatively easy to correct.
Mm-hmm. Hammer toes is easy to correct. Corn on the toes. One of the common corn that we usually correct in the office through minimally invasive is little pinky toe. So the pinky toe is always gets rubbing against the shoes when the patient walk, and sometimes it's extremely painful when the bone is become built up of the calcium deposit and it develop we call it a spur. We all hear about bone spur. So some people have excruciating pain, the shooting pain as soon as they put on shoes or they walking, the compensation happen. So that is the most common and less what I would call severe. Some people that we more concerned about is the diabetic population when they kind of like have a sensation is diminished. So they may not feel the painful threshold as a normal patient. And that's what's a concern. So the recommendations for us, for any diabetic patient, we may need to do a little bit more aggressive in terms of caring when even it's a mild case for a regular patient, but can be very detrimental for the diabetic population.
Okay, that's very good. And unfortunately, we're almost out of time. I just want to let our viewing and listening audience know that we are talking to Dr. Helene Nguyen, who is a podiatrist at Feet and Beyond. That's Mountain Avenue in Hackettstown. And Dr. Nguyen, tell our listening and viewing audience how they can again contact you, because I know we'll have people that are listening and saying, wow, this is something I have. I can't believe it's so simple to fix.
Mm-hmm. I usually tell patient or anybody in the community, if there's any question or concern, just give us a call. Right now we offer a complimentary consultation. That means no payment involvement. At least I'd be able to see the patient again. I would like to have a face-to-face with a doctor or whoever that I work with or the patients, and be able to have a better assessment of if the condition can be taken care of by minimal invasive surgery.
Okay.
So can call us 908-576-0880 or go to our website at feetandbeyond.com.
Today we dealt with some of the simple problems that occur with a person either wearing shoes or improper shoes or whatever. In our next program, let's talk about some of the more serious issues.
Mm-hmm.
And I want to thank you for being here, Dr. Nguyen. And just let our viewing audience know that I am talking to Dr. Helene Nguyen from Feet and Beyond, and she has given you all the vital statistics as to how to contact her. We encourage you to do so to eliminate that pain that you're having. Thank you.
All right. Thank you so much. Looking forward for the next one.
To find out more about minimally invasive foot treatment, contact Feet and Beyond at 908-576-0880 or visit feetandbeyond.com.